Hi, and welcome to this colloquium that looks at the impact that COVID-19 has had on Wisconsin's nonprofits. My name is Kerry Kuenzi. I'm an assistant professor at UW Green Bay, and I'm the panel chair. But because the way that we have recorded this, most people will introduce themselves and they're part of the presentation. But I just wanted to thank you all for coming. And without further ado, here's Bryce Lord.
And welcome to our presentation on the COVID-19 effect on Wisconsin's nonprofit sector. My name is Bryce Lord. I'm the Associate Director of the Helen Bader Institute for Nonprofit Management at the University of Wisconsin-Milwaukee. Our team is a cross-institutional team throughout Wisconsin with faculty from a number of different campuses in our public university system. I'll be joined later by Assistant Professor Carol Brunt from the newly formed Institute for Nonprofit Management at UW-Whitewater, Associate Professor Lora Warner from Public and Environmental Affairs at UW Green Bay, Assistant Professor Kerry Kuenzi from Public and Environmental Affairs at Green Bay, and Amy Hilgendorf, the Associate Director for the Center of Community and Nonprofit Studies at UW-Madison. Before we begin talking about the COVID-19 effect, let's take a look at where Wisconsin's nonprofit sector was before the pandemic hit the state. Overall, we're looking at, with the current reporting requirements, over 36,000 nonprofit organizations with a budget over 50,000. As we talk about Wisconsin and the overall size and scope of its nonprofit sector, we're looking at a majority of human service organizations with a significant number of education. We've had on-trend growth in Wisconsin for the last 15, 20 years. However, what's interesting is to look at the overall increase in both international environmental organizations. Most of the international growth has been in the greater Milwaukee area, and anecdotally that represents more religious-based work doing disaster and poverty relief in South and Central America. Overall revenue, we average around $38 billion statewide, looking at primarily as on-trend, large portion of program service revenue. Majority of our organizations are small, with easily 2/3 accounting with under $500,000 in overall revenue. In terms of overall economic impact, we're looking at what is consistently the third largest workforce in Wisconsin, behind construction or real estate and hotel and food services. With 12% of our workforce, that places us at the 20th largest state workforces in the country. We are still below the national average in terms of wages, and with our overall foundations contributing a significant amount through individual giving statewide. As we talk about how COVID-19 has affected Wisconsin, this particular project began with a conversation between UW-Milwaukee and UW-Whitewater as we were looking to assess overall needs for the state nonprofit sector. We decided to move this very quickly into a COVID-19 study, being joined by a number of our affiliate faculty members around the state, and using the University of San Diego as a starting point for our overall surveying process. Our goals were to measure the pandemic's impact, and primarily to then be able to take a deeper look at the impact on its services, and then be able to turn that information around to government leaders, foundation, big philanthropy, and more in order to find a way to work forward towards recovery. Our project began in April with a first survey going out the second half of April. We have just completed our second round of surveying and are now looking at that sort of Overall comparison, we will begin round 3 of surveying post-election in the early part of November with an annual checkup, more or less, continuing until we're more or less back to the new normal. The overall structure focuses on 3 different areas. Human resources, which will be addressed by Professor Brunt, finances, which will be discussed by Professor Warner, and Amy Hilgendorf will then wrap that up, looking at program delivery and services and how they have been affected. As I mentioned, the first round of surveying was done in April. We have 85% of our organizations that are looking to be a part of the project throughout this longitudinal study. So we're hoping that we can kind of maintain those numbers throughout the surveying. We have been able to get responses from a significant part of the state, not just the high density areas, but some of the counties where there are only 1 or 2 nonprofits for the entire county are reporting back. So far, the majority of responses have come from human services and arts organizations, largely due to a major push by a number of arts advocacy organizations around the state. That's given us a very specific and fascinating look into how the arts are faring in Wisconsin. And representative of our overall state sector, the number of responses have been smaller in budget size. Without further ado, then we will move on to our findings, and I'm going to turn this over to Professor Brunt.
Hello, today I'm going to give some information about human resources and our COVID-19 survey, what we learned in the second survey, and how this is really differing from the first survey that we've done, which is a longitudinal survey over time. To provide a bit of context to my comments on human resources in Wisconsin nonprofits, I just want to give a little bit of background. The sector accounts for almost 12% of total employment in the state, and 35% of Wisconsin's population volunteer in some capacity. So these are really significant numbers when discussing human resource impacts. A majority of organizations that responded to the survey operate with budgets of $500,000 or less, suggesting that there's less reliance on paid staff. And the third point is just that 37% of the respondents to this survey were in health and human services, and 14% were in arts and culture. So when we look at staff reductions, that's one of the big things that came out of this second survey. 42% of the organizations have reduced their staff to some extent. 17% are unlikely to meet payroll in the next 12 weeks. And 77% of the nonprofit leaders are concerned about potential layoff of staff. But in both surveys, over 40% of nonprofits have reduced staff to some extent. So what's telling is that nonprofits are increasingly unable to meet their payroll. So we had 12% were unable to meet their payroll over 2 months in the first survey. And in this round, that's increased to 17%. So organizations are clearly struggling in terms of how and their ability to retain their staff. The flip side is we've also heard in this survey that some employees may not want to come back after COVID. And so we're really recognizing that staff and volunteers are a primary organizational asset for these organizations, and nonprofit leaders are really justified and justifiably concerned about potential layoffs. When we look at volunteers, organizations have both struggled because volunteers are either not there because the organization has closed, or because there's actually a lack of volunteers. So in both surveys, it was 79-80%, around 80% in survey 1 and 79% in survey 2 that acknowledge that they have reduced volunteers to date. What's important here, though, is that the agencies do recognize that it's the generosity of their volunteers that help them run their organizations, but volunteers are now saying they are very fearful and too scared to return to their positions, as volunteers are often older. So the shift of the workload onto staff is increasing staff work stress levels. So these become to be more health and safety concerns both for volunteers in their lack of interest in returning to the organization, but also staff now in terms of their mental health and stress and having increased workload. When we look at boards came up and the composition of those boards, and we found in survey 2 that leaders are reporting that boards are not fully engaged or they're absent. And this is in part a problem that was suggested that existed pre-COVID. Boards are also not constituted in some cases to be fundraising boards. So that creates increased financial challenges for the organization. In some cases, boards are overwhelmed with policy issues. All of these issues with boards are posing real challenges for organizations in their attempts to develop donor relations. And these issues are similar to what was mentioned in survey 1. What's not mentioned in survey 2 is the impact of reduction in public services. In survey 1, we heard quite clearly that public services who had reduced their services, they placed greater demand on the nonprofits. And so what we find in some cases with the boards, as this account from one agency is quite telling, there's a real tension between boards who are dependent, who should be providing guidance and perhaps some fundraising assistance to these nonprofits. One nonprofit actually reports how there's personal anxieties coming into play now from board members who are really trying to stay on top of issues. And the board members are really seeking regular updates on finances that diminishes staff morale and is placing much more reporting requirements on staff, taking them away from their regular staff tasks. So lastly, there's a couple of things that really stand out here from this survey that's new in survey 2 as opposed to survey 1. Testing. That was not mentioned in survey 1. In survey 2, nonprofit leaders are speaking to the inability of their employees to get tested and the fact that as small staff, having a staff member go off on a 14-day quarantine creates a real hardship for the agency. The second standout issue is skill demands. Nonprofit leaders are reporting that now that they've gone virtual, there are heavy tech requirements and their staff needs to adjust to reflect that. And they are having challenges because staff talents are no longer reflecting those new needs. And they have some staff that have been with them for a long history with the organization, but they just don't have these tech requirements. And so nonprofit leaders are struggling with that required change in staff demands. Lastly, health insurance is the other issue that stands out in this survey. Health insurance renewals for staff are skyrocketing, according to one nonprofit, which is becoming increasingly burdensome. And in fact, another nonprofit reports that they may change a portion of their insurance premiums as the employer portion and bring that down to a lesser amount in terms of being able to meet their organizational budget on top of all the other reductions they've made. So those are 3 of the really standout issues that are top of mind here in survey 2.
Amy Hilgendorf, Associate Director for Engaged Research at the Center for Community and Nonprofit Studies at the University of Wisconsin-Madison. And for my portion of the presentation, I'll be talking about what we've learned about programs and services and how those have been affected by the COVID-19 pandemic among Wisconsin nonprofits. So again, I'm from the Center for Community and Nonprofit Studies. I work in a unit that we call Co-Create, where we do applied research and program evaluation for nonprofit partners. So as partners in the survey, specifically what our center has looked at is at the delivery of regular programs and services during the COVID-19 pandemic, the responses in the survey to likelihood to continue to provide services in the near future. We looked at the open-ended questions included in the survey about changes in service and client needs. And just as a reminder, in these surveys, we had about 525 respondents in the first round, 481 in the second round, and consistent respondents between the two looked at about 175 respondents. So digging into those, what we found is the extent that folks were able to continue to deliver their regular programs and services has definitely been impacted. Very few were able to say that they're doing the same as they always do. A significant chunk in both time 1 on the left and time 2 on the right are continuing to offer programs, but they're being delivered in a different way. But many others indicate that they've had to reduce services. Over time, it looks like there may be more of a shift to providing programs and services differently. However, we don't yet know fully why we see this trend. There may be aspects of attrition here, whether it's to the survey or nonprofits shuttering doors or not being able to reply. We don't yet know. So in the open-ended questions, we asked them, what do these changes to services look like? This word cloud just shows some of the responses that we got. And the most consistent patterns, as you might guess, is people change their services to many virtual or online capacity. But other people also talked about focusing more on providing for the individual needs of their clients. So that's one-on-one reach outs, focusing more on basic needs and changing in that way to really serve their constituents. We asked them, what do their constituents need in the first survey? And you can see, again, basic needs pop up a lot: food, hygiene care, as well as care, mental health care, and for some, connection to technology or other services as well. We also asked about the marginalized the clients, or those who might have more need for services. And you can see that for many organizations, they have been able to offer less services to their more marginalized individuals. We weren't able to ask this in the second survey, but this is an important consideration for nonprofits and those who serve them. In an open-ended, we asked, who are these marginalized clients they're especially concerned about? And they talked about people with disabilities, low-income communities, homeless community members, undocumented community members, families with children, many, and elderly folks as well. So we also asked in each survey, how likely is it that you'll be able to adequately provide services in the near future? We asked 8 weeks in the first survey, 12 weeks in the second survey. And here you can see that there may be this trend towards more stability, but we don't yet know. So thinking about that, we looked at, have things improved? And this is just one way that we've looked at it. And we looked at that first question, to what extent are you currently delivering regular programs and services, and changes from the first round to the second round. And many have said no change. Some indicated that things have improved, and a smaller group indicated that things have gone in the other direction. So, however, these changes tend to be just one indicator from, somewhat likely to more likely. So there's some suggestion nonprofits may be stabilizing, but we don't yet know. In future analyses, we hope to look at subsector. So is it different for arts to education, size of the nonprofit, or what their leadership and board looks like? Those are all questions that we hope to pursue in the future. So that's it for me. Again, my name is Amy Hilgendorf. I'm from University of Wisconsin-Madison, and here's my email. I encourage folks to reach out with any questions.
Hi, I'm Lora Warner at University of Wisconsin at Green Bay. My co-author and I, Erica Sika from University of Wisconsin-Milwaukee, are part of this collaborative study of the impact of COVID-19 on Wisconsin nonprofits, organized by the Helen Bader Institute for Nonprofit Management at Milwaukee, along with UW-Whitewater's Institute for Nonprofit Management. I will share my screen. Our talk is titled Balancing Money and Mission, the Impact of COVID-19 on Financial Institutions, Financial Capacity of Nonprofit Organizations. And we will be talking about part of what we hope is a longer term research agenda for us, looking at how changes in revenue and revenue sources impact organizations' ongoing ability to provide critical services. So first of all, the first research question is how is the pandemic affecting these revenue generating activities 4 months after the pandemic? And you can see that we're up in the 80% of them have either to some extent or great extent changed in some of their activities. 3/4 of them have canceled major fundraisers. Another 3/4 have received some type of emergency grant, not specified private or public. About 80% have communicated with all donors, but not that much for many of them, or reached out to major donors to a great extent, about 1/3. And this was 4 months, this was in April. Reduced staff, a few of them have had to do this. I'm sorry, this was in August. This is in wave 2. A bunch of them have involved their board, but some only to some extent, a good deal. And then collaborate with other nonprofits. Some of these are indirectly related to fund development and revenues, but collaborating may enable you to keep doing some of the services in partnership. The second research question, how does the federal stimulus funding affect their capacity to continue to fund payroll over the next 12 weeks? Again, this came from the second wave of the survey, and we're able to look more at those who received a grant and those who did not receive PPP funding. And you can see that 2/3 of them did apply for this grant. And you can see the lower mean score means they're very unlikely to continue to fund payroll. And you can see that there's a statistically significant difference. And those that did receive a grant have a much more higher likelihood, 3.31, of being able to continue to fund payroll over the next few weeks, over the next 12 weeks. So that payroll stimulus funding did seem to have a significant impact on the nonprofits. And a related question, what about the PPP affecting the capacity to continue to provide services? And again, those that got the grant, 2/3 of them had a much higher likelihood, statistically significant, greater likelihood of being able to provide services. We need to tell our elected officials about this information. We probably will, because it does seem that it really did sustain and help these nonprofits financially to be able to continue to maintain their staff and to maintain their services and activities.
So with that, I'd like to thank you for coming to our presentation. As you can see, the COVID-19 pandemic has impacted Wisconsin's nonprofits in a variety of ways, including their human resources, their ability to offer programs and services, and their finances. And now we'd like to turn it over to Mike Ford, who will be the discussant for this presentation. And as well, we would welcome questions from the audience at the end.